Hi guys, welcome back to the Recovery Channel. Just answering a question regarding urination post-stroke. A male is having trouble initiating urination. Now I've done several videos on that, but since then I've read more books and I've learned more about why it happens. I still certainly have trouble initiating urination. Sometimes it can take between a minute to 10 minutes to start weeing, and I usually sit down just because it takes that long and it's easier. There's nothing unmusculating about sitting down weeing. Don't worry about any of that. All that's out the window nowadays. So your urinary control is not in your motor function up here per se, as in your cerebral cortex is the last part of the brain that was evolved. Urinary control is very old. It's older than trees. The ability for an organism to hold its urine and choose when it lets it out is extremely old, and it's tucked away nice and safe in your brainstem, usually in your pons, your urinary control. The problem is, after you have a stroke, you may think urinary control got affected by the middle cerebral artery stroke. It didn't. The problem is you've got this urinary sphincter, which is a tiny little muscle connected to your pons and your brainstem, and that tells you when to urinate and when to hold it, like when it's perfect timing or when it's dangerous to urinate. So the problem is when you have a stroke, if you have an MCA stroke like I did, you may have some frontal lobe issues, and you may have anxiety, depression, shy weeness, they call it. Like you prefer to use a stool, you don't want to use a urinal. Those stalls at restrooms, they just scare the hell out of me. I have to go to one of those ones that you can shut the door if I want to urinate. So yeah, urinary control wasn't affected as far as brain function unless you've had a brainstem or pons stroke. In that case, it's a completely different story. But the garden variety stroke that I'm talking about, urinary continence, it's because your frontal lobe, it's like your brain's getting in the way of you weeing. You're trying to open your urinary sphincter in your bladder, and you're sitting down, you're like, it's okay to wee now. But your brain, your frontal lobe's going open, shut, open, shut, open, shut, open, shut. And this can happen for an hour until you settle down and begin initiating urination. Pushing to urinate is not how you do it. Pushing comes whilst urinating, and that's got more to do with the prostate gland and Kegel exercises, Kegel exercises can extremely help continence post-stroke. I certainly did my fair share of that, but you don't push to initiate urination. You push whilst urinating. Pushing has nothing to do with urination. It's the opposite. You're letting go. So it's more to do with your breathing than anything else. Sometimes I'll be sitting there for maybe 5 or 10 minutes and just think, oh, like, why haven't I started yet? And then a random thought will pop into my head. And when I'm completely dissolved in that thought, that's when I initiate urination. So somebody studying urinary continence can probably write a paper on that. Not me, but somebody else. So initiating urination post-stroke happens when you control your breathing and you control what you're thinking about, basically. That's the best advice I can get for initiating urination post-stroke. Thanks for tuning in, guys. Looking forward to making lots more content.